My name is Cherin Tikono. I'm a fifth-year student studying Bachelor of Medicine and Surgery at the University of Nairobi.
My name is Mohammed Ali Omar. I am currently a fifth-year medical student at the University of Nairobi, and the program I'm currently doing is Bachelor of Medicine and Bachelor of Surgery.
The Merck Capacity Advancement Program is an excellent program because it enables us to get to know what is going on in medicine, the advancements that are being made in medicine. Medicine is a dynamic career. It changes day by day. There's something new, something different you can learn. So keeping up with such programs enables us as upcoming physicians to be able to treat our patients as is now with the new developments that are there now. A big problem we have is sometimes we are not up to date with the different and new techniques that we can use in our practice. So going to such symposiums and being exposed by programs such as the Merck program would enable us to keep up to date and to be better doctors, better physicians in the future.
This is the first of its kind, especially by a pharmaceutical company, whereby Merck is coming and involving especially the undergraduate students, the postgraduate students, and also the professors in trying to build capacity both at a local level and at an international level. From my interactions with the people at Merck, they think that this is going to be a long-term project, and it's not necessarily only for me, but also for other medical students who are following me in medical school, to be able to build their capacity and be able to know about new techniques that are going on in the field, advancements that are happening every day. The Merck Capacity Advancement Program is multi-pronged, not only necessarily for the physicians, but also for the patients and the community in large. In Africa, currently we have something called the double burden of disease, whereby the double burden of disease refers to we have already a high burden of infectious diseases, which is not as common in the Western world, but we're also having what we used to call the westernized diseases, which are now becoming very common here, especially diabetes and hypertension. So it's also in the rural areas and also in the urban areas, it's very important for each and every one of us to give health education to the people who are not particularly in the medical field.
Doctors are seen as the connection to medicine, the connection to diseases. So a doctor going to speak to somebody about a disease or something they're going through will definitely enable the person to understand what is happening to them and for them to be able to manage themselves adequately. So I think giving doctors steps, enabling doctors to move towards advancement in medicine, enabling them to understand different fields, different aspects of specific morbidities or diseases, allows them to be able to talk to their patients and bring them to the level of knowledge, a level where they can be able to take care of themselves with the help of the physicians.
We had a symposium with one of the professors, I think, from Oxford University, and he came here to discuss basically advancements in diabetes and new medications that are around, new guidelines, new recommendations that are given, and why they're actually going in that direction. We have a similar burden of illness that is actually almost reaching what they have in the UK. And we had basically an exchange of ideas with Professor Otieno, who's our professor here at the University of Nairobi, making several presentations. And we also had the professor from Oxford, who also had presentations on their experiences in Oxford. So it was an exchange of knowledge on what we are seeing here in the developing world and what they're seeing there in the developed world, and what we can do to work together to at least try and be at par in terms of management of these non-communicable diseases, especially diabetes and hypertension.
I think we are headed in the right direction. We just need to keep getting to know how the disease can be managed and teaching our people that diabetes and hypertension is not the end of the road. that lifestyle changes could possibly take us to the right direction. So I think the major thing with hypertension and diabetes and other non-communicable diseases in our country and in Africa at large is sensitization and teaching people to be able to live healthier lifestyles and to become better individuals.
The way forward as a country is the several things we could do. Number one is to increase our health education to the lay people, especially people who are not in any way related to someone who's in the medical field, be it a nurse, a medical doctor, a dentist, a pharmacist, or someone in the field of medical laboratories. There's a huge population in Kenya who does not have access to or are related to these people. So health education is quite important for these people. And health education has to start from everyone who's at the top to the person who's at the bottom. We have to have people who are going to primary schools, secondary schools. We even have to have our parliamentarians getting involved in this awareness about diabetes.